Welcome back to NutriHub Bliss, where we believe that understanding your body's subtle signals is the first step toward lasting wellness. Today, we turn our attention to an often overlooked sentinel of health, your liver. Nestled quietly beneath the right side of your rib cage, this remarkable organ performs more than 500 vital functions every day, filtering toxins from the bloodstream, metabolizing nutrients, producing bile to aid digestion, and even regulating hormones. Yet because the liver itself has no pain receptors, it rarely protests when under strain. Instead, it sends out discreet warning signs that many of us dismiss as mere fatigue, skin blemishes, or digestive hiccups. In the hustle of modern life, where processed foods, environmental pollutants, and stress converge, our livers work overtime to keep us functioning. From the moment we sip our morning coffee to the times we reach for over-the-counter painkillers, every choice places a burden on our detoxification pathways. Over time, this cumulative load can impair liver efficiency, allowing toxins to accumulate in the blood and tissues. Left unaddressed, this buildup can progress from fatty liver to more serious conditions such as fibrosis or cirrhosis. The good news is that your body gives you early clues long before irreversible damage occurs. By learning to recognize these 9 warning signs, ranging from unrelenting tiredness to unexplained changes in your skin, breath, and even bathroom habits, you can take proactive steps to support liver health. Throughout this video, we will explore each symptom in depth, explain the science behind why it arises, and offer practical, evidence-based strategies to restore your liver's vitality. Whether you live in a bustling city, work from home, or spend long hours on the road, these insights are designed for the international audience of NutriHub Bliss. In the United States, Canada, New Zealand, Australia, and beyond. Our goal is to empower you with clear, science-backed knowledge delivered in a warm, accessible tone. So settle in, grab a glass of water, and let's embark on this journey to decode your liver's silent signals and reclaim the vibrant health you deserve. 1. Persistent fatigue. Despite adequate rest, have you ever awakened after a full night's sleep, 7 or 8 hours, and still felt as though you were slogging through quicksand? That bone-deep weariness where even simple tasks like getting dressed or making breakfast seem daunting may be more than just a consequence of a busy schedule or a rough week. Persistent, unexplained fatigue is one of the earliest and most pervasive indicators that your liver may be struggling to keep up with its detoxification duties. Under normal circumstances, your liver filters out metabolic byproducts and environmental toxins, converting them into harmless compounds or directing them into bile and urine for elimination. When toxin levels exceed the liver's processing capacity, these waste products linger in the bloodstream, triggering a cascade of effects that sap energy at the cellular level. Mitochondria, the tiny powerhouses inside your cells, can become overwhelmed by oxidative stress, reducing their ability to generate ATP, the molecule that fuels every physiological process. The result is a chronic sense of lethargy that does not improve with sleep or rest. Moreover, an overburdened liver can impair glucose metabolism. After meals, the liver helps regulate blood sugar by storing excess glucose as glycogen and releasing it when energy is needed. When liver function declines, this balance is disrupted, leading to erratic blood sugar swings, spikes that may leave you feeling jittery, followed by crashes that exacerbate fatigue. You may notice a mid-afternoon slump that no amount of coffee seems to fix, or you might feel lightheaded when standing up too quickly. Beyond these metabolic disruptions, the accumulation of toxins can provoke low-grade systemic inflammation. Cytokines, immune signaling molecules, are released in response to perceived threats, and while they play a protective role, chronic elevation can cause sickness behavior, a term scientists use to describe the malaise, social withdrawal, and cognitive fog that accompany persistent inflammation. In practical terms, you might find it harder to concentrate at work, remember simple details, or stay motivated to exercise. If you recognize this pattern, adequate sleep yet relentless exhaustion, consider evaluating your liver's supportive habits. Simple interventions such as prioritizing hydration, adopting a nutrient-dense diet rich in leafy greens and cruciferous vegetables, and limiting alcohol intake can significantly lighten your liver's workload. Regular gentle exercise, such as brisk walking or yoga, also enhances mitochondrial efficiency and supports circulation, helping your body clear toxins more effectively. In the following sections, we'll explore additional warning signs and concrete strategies to revitalize your liver's performance. 2. Unusual breath odor. A silent message from the liver. Most of us attribute bad breath to garlic-rich meals or a skipped brushing session, but when persistent halitosis lingers despite impeccable oral hygiene, your liver may be the underlying culprit. The liver's detoxification pathways break down nitrogenous waste products, particularly ammonia, into urea, which the kidneys then excrete. When this process falters, ammonia and other volatile compounds build up in the bloodstream, eventually escaping through your lungs and causing a distinctive, unpleasant odor. Chemically speaking, elevated blood ammonia levels create a condition known as hyperammonemia, which can manifest not only as foul breath but also as confusion, irritability, and in severe cases, hepatic encephalopathy. Even mild elevations can produce a metallic or fishy smell in the mouth that mouthwash and mint cannot mask. Similarly, sulfur-containing compounds, byproducts of protein digestion, may accumulate, leading to a rotten egg scent that hints at impaired hepatic clearance. This phenomenon underscores the intimate connection between liver health and respiratory excretion. Unlike the kidneys, which filter blood under high pressure, the lungs eliminate gaseous waste that circulates freely. Thus, unusual breath odor is often an early and overlooked sign that the liver's phase 1 and phase 2 detoxification enzymes, cytochrome P450 oxidases and conjugation pathways, are operating below optimal capacity. To address this issue, consider a multi-pronged approach. First, reduce your intake of protein sources that are high in sulfur, such as red meat and eggs, and replace them with plant-based proteins like lentils, chickpeas, and tofu, which tend to produce less noxious byproducts. Next, support hepatic detoxification with foods rich in antioxidants and phytonutrients. Cruciferous vegetables, broccoli, Brussels sprouts, beets, and leafy greens stimulate phase 2 conjugation enzymes, aiding in the neutralization of ammonia and other toxins. Hydration remains crucial. Water helps dilute blood ammonia levels and supports kidney excretion. Aim for at least 2.5 liters daily, and consider incorporating herbal teas such as dandelion root or milk thistle, which have long been used in traditional medicine to promote bile flow and protect hepatocytes. Finally, practicing mindful breathing exercises, like diaphragmatic breathing, can enhance lung clearance of residual volatile compounds, offering temporary relief while you work on restoring liver function at its source. Number 3. Deteriorating skin. Acne, dullness, and widespread rash. Your skin is often described as a mirror reflecting internal health, and nowhere is this more evident than in the relationship between liver function and dermatological well-being. When the liver is overtaxed by environmental pollutants, medications, or poor dietary choices, toxins that should be processed and eliminated instead recirculate in the bloodstream and are excreted through the skin. This diversion can manifest as persistent acne, uneven skin tone, dry patches, and even itchy rashes across the face, chest, or back. At a cellular level, the liver's Kupffer cells, resident macrophages, work to clear bacteria, endotoxins, and cellular debris. When overwhelmed, these cells release pro-inflammatory cytokines, contributing to systemic inflammation. Inflammatory mediators such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-α, can exacerbate conditions like acne vulgaris by stimulating sebum production and promoting follicular hyperkeratinization. The result is clogged pores and bacterial overgrowth, leading to the red, inflamed pustules characteristic of breakouts. Beyond acne, toxin overload can impair collagen synthesis, leading to a loss of skin elasticity and the appearance of dullness or premature fine lines. Collagen production requires adequate levels of vitamin C, proline, and glycine, nutrients that the liver helps regulate through amino acid metabolism. When hepatic function declines, nutrient imbalances may occur, compromising the skin's structural integrity. To support skin health from within, focus on a liver-nourishing diet rich in antioxidants and essential fatty acids. Foods like blueberries, strawberries, and dark leafy greens provide flavonoids and carotenoids that neutralize free radicals and reduce oxidative stress. Incorporate omega-3 sources such as wild-caught salmon, chia seeds, and walnuts to modulate inflammatory pathways and maintain cell membrane fluidity. Topical care can complement these internal measures. Look for cleansers and moisturizers containing gentle, non-comedogenic ingredients like aloe vera, niacinamide, and ceramides to soothe irritation without stripping natural oils. Periodic exfoliation with low-concentration alpha-hydroxy acids AHAs can help clear dead skin cells and support turnover, but avoid over-exfoliating, which can exacerbate inflammation. Finally, don't underestimate the role of stress management. Chronic psychological stress elevates cortisol, which can impair liver detoxification enzymes and trigger breakouts. Techniques such as mindfulness meditation, deep breathing exercises, or restorative yoga can lower cortisol levels, indirectly benefiting both your liver and your complexion. Before, yellowing of the skin or eyes. Perhaps the most visually striking sign of compromised liver function is jaundice, the yellowing of the skin and the whites of the eyes. Sclera. This discoloration results from elevated levels of bilirubin, a yellow pigment produced during the normal breakdown of red blood cells. Under healthy conditions, the liver conjugates bilirubin, making it water-soluble and ready for excretion via bile. When this process is disrupted, whether by toxin overload, bile duct obstruction, or hepatic cell injury, unconjugated bilirubin accumulates in the bloodstream, depositing in tissues and imparting that characteristic yellow hue. In early stages, mild jaundice can be subtle, only noticeable under bright, natural light. You might first detect a faint yellow tint in your eyes or a slightly sallow complexion. Left unaddressed, bilirubin levels can continue to rise, leading to darker yellow or even greenish discoloration and potential itching, pruritus, as bile salts accumulate in the skin. Severe cases may signal serious conditions such as hepatitis, gallstones blocking the bile ducts, or advanced fibrosis. If you observe any degree of yellowing, it's crucial to seek medical evaluation promptly. A healthcare provider will typically perform liver function tests, measuring levels of bilirubin, alanine aminotransferase (ALT), and aspartate aminotransferase (AST) to assess the liver's health. Imaging studies like ultrasound or MRI may be ordered to check for structural abnormalities or bile duct obstructions. While awaiting professional guidance, you can take supportive measures. Adopt a liver-friendly diet that emphasizes whole foods, colorful vegetables like carrots and bell peppers, rich in beta-carotene, cruciferous vegetables such as broccoli and cauliflower, which support phase 2 detoxification, and lean protein sources like skinless poultry and legumes. Avoid processed foods, refined sugars, and trans fats, which can exacerbate inflammation and worsen liver stress. Hydration remains essential. Ample water intake helps the kidneys assist in excreting excess bilirubin. Herbal supplements such as milk thistle, Silybum contain silymarin, a flavonoid complex shown to stabilize liver cell membranes and promote regeneration. While research is ongoing, many find that 200 to 400 milligrams of standardized silymarin daily can offer gentle support. Always consult your healthcare provider before starting new supplements, especially if you take other medications. By responding swiftly to early signs of jaundice and embracing supportive lifestyle changes, you can help your liver recover its ability to process bilirubin effectively and restore your natural complexion. Number 5. A heavy or aching sensation in the upper right abdomen. Have you ever noticed a persistent, dull ache or sense of fullness beneath your right rib cage? Unlike the sharp, cramping pains of indigestion or gallbladder attacks, liver discomfort often manifests as a vague heaviness or pressure that intensifies after meals or when lying on your side. This sensation arises when the liver becomes inflamed or enlarged, a condition known as hepatomegaly, due to fat accumulation, toxin buildup, or inflammation. On a microscopic level, hepatocytes, liver cells respond to stressors, excessive alcohol, high-fat diets, or environmental toxins by storing triglycerides, leading to fatty liver disease. As lipid droplets accumulate, the liver's overall volume increases, stretching its capsule, Glisson's capsule, and triggering nociceptors, pain receptors, embedded in the connective tissue. The result is that characteristic, full feeling that can subtly interfere with deep breaths or gentle twists of the torso. While mild discomfort can often be managed at home, persistent or worsening pain warrants medical evaluation. A healthcare provider may perform an ultrasound or CT scan to assess liver size and texture. Blood tests will evaluate liver enzymes, ALT, AST, alkaline phosphatase, ALP, which rise when hepatocytes are injured or bile flow is obstructed. To alleviate discomfort and address root causes, begin by reducing your intake of alcohol and saturated fats, both of which contribute to fat deposition in the liver. Replace these with heart-healthy fats from avocados, nuts, and olive oil, which contain monounsaturated fatty acids that support lipid metabolism. Increase consumption of fiber-rich foods, whole grains, legumes, fruits, and vegetables, to improve insulin sensitivity and help the liver offload excess fat. Regular physical activity plays a pivotal role in reversing fatty liver. Studies show that even moderate aerobic exercise, such as brisk walking, cycling, or swimming for 30 minutes 5 times per week, can reduce liver fat content by up to 10–15% over several months. Strength training adds further benefit by increasing muscle mass, which enhances basal metabolic rate and improves overall glucose handling. Herbal allies like turmeric, curcumin exhibit anti-inflammatory properties that may protect hepatocytes. Incorporate turmeric into meals or take standardized curcumin supplements, typically 500 milligrams twice daily, under medical guidance. Milk thistle, as mentioned earlier, also supports liver regeneration. Combined with lifestyle modifications, these strategies can ease discomfort, shrink liver size, and restore optimal function over time. Number 6. Digestive problems, indigestion, and irregular bowel movements. Your liver and digestive system operate in a finely tuned partnership. The liver produces bile to emulsify fats, facilitating their breakdown and absorption in the small intestine. When liver function is compromised, bile production or flow may decrease, leading to poor fat digestion, bloating, and irregular bowel habits. You might experience alternating bouts of constipation and diarrhea, persistent indigestion after meals, or a sensation of incomplete evacuation, symptoms that many attribute to stress or dietary indiscretion. From a biochemical perspective, bile acids also act as signaling molecules that regulate gut motility and microbiome composition. Reduced bile flow, cholestasis, can alter the balance of beneficial bacteria, promoting dysbiosis and increasing the production of gas and inflammatory metabolites. This can create a feedback loop. Gastrointestinal inflammation further stresses the liver, while an impaired liver exacerbates digestive dysfunction. To restore harmony, begin by optimizing your diet. Prioritize whole foods rich in soluble and insoluble fiber, oats, flaxseed, apples, and leafy greens, to normalize stool consistency and support beneficial gut microbes. Incorporate fermented foods like yogurt, kefir, kimchi, and sauerkraut, which deliver live probiotics that can rebalance your microbiome and enhance bile acid metabolism. Gentle digestive bitters, herbal extracts such as gentian root, dandelion leaf, or artichoke leaf have been used traditionally to stimulate bile flow and improve gallbladder function. Taking a small tincture, 20 to 30 drops before meals, can prime your digestive system for efficient fat processing. Peppermint tea after eating can soothe spasms in the gastrointestinal tract, alleviating bloating and cramping. Hydration continues to play a crucial role. Adequate fluid intake keeps bile and stool moving smoothly. If constipation predominates, consider supplementing with magnesium citrate, 200 to 400 milligrams at bedtime, which draws water into the intestines and promotes regularity. However, use laxatives sparingly and under guidance, as overuse can further disrupt gut-liver interactions. Finally, practice mindful eating habits. Chew your food thoroughly, eat smaller meals more frequently, and avoid lying down immediately after eating. These simple behavioral changes reduce digestive stress and give your liver and gastrointestinal tract the support they need to work in concert, restoring comfort and regularity to your daily routine. Number 7. Unexplained bruising or bleeding. Have you ever noticed that minor bumps leave large dark bruises, or that your gums bleed after gentle brushing? While easy bruising and mild bleeding can occur for many reasons, when they happen without clear cause, they may signal impaired liver function. The liver synthesizes most of the body's clotting factors, proteins such as fibrinogen, prothrombin, and factors 7, INX, and X, that orchestrate the complex cascade of blood clot formation. When liver cells are damaged, production of these essential proteins declines, increasing bleeding tendency. Laboratory tests often reveal prolonged prothrombin time, PT, or elevated international normalized ratio, INR, reflecting delayed blood clotting. Clinically, this can manifest not only as bruises and bleeding gums, but also as frequent nosebleeds or heavier than normal menstrual bleeding in women. While mild elevations may be managed conservatively, significant coagulopathy requires prompt medical attention, and in some cases, vitamin K supplementation or clotting factor replacement. To support healthy clotting function, focus on nutrient-dense foods rich in vitamin K1, phylloquinone, found in leafy greens like kale, spinach, and collard greens, and vitamin K2, menaquinone, present in fermented foods such as natto and certain cheeses. Adequate protein intake is also essential, as clotting factors are proteins. Include lean sources like fish, poultry, beans, and lentils in your diet. Avoid unnecessary use of non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin, which can further inhibit platelet function and exacerbate bleeding. If you require pain relief, discuss alternative options with your healthcare provider, such as acetaminophen in safe dosages or topical therapies. Herbal interventions should be approached with caution, as some botanicals, like ginkgo biloba or high-dose garlic supplements, can also affect platelet function. Always inform your provider of any herbs or supplements you take. Instead, focus on gentle liver-supporting herbs like milk thistle and dandelion, which promote cellular regeneration without interfering with clotting pathways. By nourishing your liver and providing the raw materials it needs to produce clotting proteins, you can reduce the frequency of unexplained bruising and bleeding, restoring confidence in your body's ability to heal and protect itself. Number 8. Changes in urine and stool color. A simple glance at your bathroom output can yield powerful insights into liver health. Under normal conditions, bile pigments give stool its characteristic brown color, while urine ranges from pale straw to light amber. When the liver's ability to process bilirubin or excrete bile is compromised, these colors shift. Urine may darken to deep yellow or tea-colored, and stool can become pale, clay-colored, or even chalky white. Dark urine indicates that excess bilirubin, which the liver failed to conjugate, is being filtered by the kidneys. This water-soluble form of bilirubin imparts a darker hue to urine and can be an early sign of cholestasis or bile duct obstruction. Pale stool suggests that bile is not reaching the intestines, depriving the colon of stercobilin, the pigment responsible for normal fecal coloration. In severe cases, you may observe floaters in the stool due to undigested fat, an indication of malabsorption known as steatorrhea. If you notice these changes, document the duration and any accompanying symptoms, such as itching, abdominal pain, or jaundice, and share this information with your healthcare provider. Diagnostic tests may include liver function panels, imaging studies, and, if necessary, endoscopic evaluation of the bile ducts. While awaiting professional guidance, you can support bile production and flow through dietary measures. Incorporate healthy fats like extra virgin olive oil, which stimulates the gallbladder to contract and release stored bile. Bitter foods, such as arugula, endive, and grapefruit, also encourage bile secretion. Drinking warm water with a squeeze of lemon first thing in the morning can gently wake up your digestive system and prime bile flow. Supplemental ox bile or digestive enzymes containing lipase may offer temporary relief for steatorrhea, but they should be used under medical supervision. Hydration remains key. Ample fluids help flush excess bilirubin through the kidneys, lightening urine color and easing renal workload. By paying attention to these simple visual cues, you gain a non-invasive window into your liver's performance. Early recognition and intervention can prevent progression to more severe hepatic or biliary disorders, preserving both digestive comfort and overall vitality. 9. Unexplained weight gain or abdominal fat accumulation. Finally, if you found yourself gaining weight around your midsection despite maintaining your usual diet and activity level, your liver may be playing an unseen role. The liver orchestrates lipid metabolism, breaking down dietary fats, synthesizing cholesterol, and packaging triglycerides into lipoproteins for transport. When hepatic function falters, this balance tips toward fat storage, particularly visceral fat that envelops internal organs and sits deep within the abdominal cavity. Visceral fat is metabolically active, releasing pro-inflammatory cytokines and free fatty acids directly into the portal vein, which delivers blood to the liver. This first-pass exposure exacerbates hepatic inflammation and insulin resistance, creating a vicious cycle. A compromised liver promotes more fat storage, and increased visceral fat further impairs liver health. Over time, this can escalate into non-alcoholic fatty liver disease, AFLD, which affects up to 25% of adults worldwide and is closely linked to metabolic syndrome. To break this cycle, focus on a holistic approach that combines diet, exercise, and targeted nutrients. Adopt a low-glycemic eating plan rich in whole grains, legumes, and non-starchy vegetables to stabilize blood sugar and reduce insulin spikes. Limit refined carbohydrates and sugary beverages, which drive fat synthesis in the liver, de novo lipogenesis. Exercise remains a cornerstone. A blend of aerobic activities, e.g. brisk walking, jogging, swimming, and resistance training, e.g. weightlifting bodyweight exercises, can reduce visceral fat by up to 20% within 3 months. High-intensity interval training, HIIT, has also shown promise in improving insulin sensitivity and accelerating fat loss, but choose modalities that suit your fitness level and health status. Certain nutrients support lipid metabolism. Omega-3 fatty acids, found in fatty fish, flax seeds, and chia seeds, help modulate genes involved in fat oxidation and reduce inflammation. Supplementation with 2-3 grams of combined EPA and DHA daily has been associated with reduced liver fat content. Additionally, compounds like berberine, 500 milligrams twice daily, and green tea extract, standardized to 50% EGCG, 300 milligrams daily, exhibit hepatoprotective effects and may improve lipid profiles. Mind-body practices such as yoga and meditation can lower cortisol, the stress hormone that promotes abdominal fat deposition. Adequate sleep, 7 to 9 hours per night, also regulates appetite hormones, ghrelin and leptin, and supports metabolic health. By addressing these multiple fronts, you can reverse unwelcome weight gain, shrink visceral fat stores, and restore your liver's capacity to manage lipids effectively. Your liver is a silent workhorse, tirelessly filtering toxins, metabolizing nutrients, and maintaining metabolic harmony. Yet, when its capacity is exceeded by poor diet, environmental pollutants, stress, or sedentary habits, it whispers warnings rather than sounding alarms. From relentless fatigue and foul breath to skin changes, digestive woes, and even shifts in your bathroom habits or body shape, these 9 signs serve as vital red flags that your liver needs support. At NutriHub Bliss, we champion a holistic, science-backed approach to wellness that you can integrate into everyday life. By recognizing these early indicators and taking targeted action, optimizing your diet with fiber, antioxidants, and healthy fats, prioritizing hydration, incorporating gentle herbal allies, and committing to regular movement, you empower your liver to heal and thrive. Remember, consistency is key. Incremental, sustainable changes often yield the most profound and lasting results. If you experience severe symptoms, significant jaundice, unrelenting abdominal pain, or marked coagulopathy, seek medical evaluation promptly. However, for most individuals, these natural strategies can reverse early dysfunction and forestall progression to serious liver disease. Thank you for joining us on NutriHub Bliss. We hope this in-depth exploration equips you with the knowledge and tools to listen to your body's quiet signals and nurture your liver's remarkable resilience. If you found this video insightful, please like, share, and subscribe so we can continue bringing you warm, professional, and evidence-based health guidance. Here's to a vibrant, toxin-free life. See you in our next NutriHub Bliss episode.